Good afternoon, everybody. Wow, what a glorious, glorious day. My name is Izzy Firth-Shaikoff. I am the chair of the board here at Forest Hills of DC, and on behalf of our residents and our staff and the board, I want to welcome you all here to this great facility. We are really, really thrilled to be able to host this event for the mayor, for Mayor Bowser. Thank you for coming. And her whole team here this afternoon. Our CEO, Tina Sandry, would actually be doing this introductory piece right now, except that she's in Hawaii with her daughter and decided that might trump this. I don't know, probably a good decision on her part. But she asked me to stand in for her today. Forest Hills, if you're not familiar with Forest Hills of DC, we've been around a while. We were actually started in 1889 with the help of Foundry United Methodist Church, which is down on 16th Street. We've actually been in a number of locations in the city, but we've been on this site since 1926. Our mission is to continually grow as a supportive community that inspires and engages our seniors. You know, the past few years have certainly been challenging for all of us, to say the least. Enduring this pandemic has been an extraordinary experience for all. And we still really don't know what's ahead of us with regard to COVID. But I want you all to know that we are now also confronted with a crisis of a different nature. But it's not completely born out of COVID, but it's certainly been made much, much worse by COVID. And that is the crisis of workforce. We don't have enough people taking care of our seniors, and we don't have enough people engaged as professionals in the healthcare sector in general. Nationally, since COVID, the senior care field has lost hundreds of thousands of workers, most of them direct care professionals. This is a crisis, and it's not sustainable. DC's experience has been very similar. Right now, 22% of Forest Hills positions are vacant, and we're actively recruiting to try and fill them every day. Our CEO, Tina Sandry, and our administrator, Crystal Scott here, and the leadership team at Forest Hills has recently introduced a registered apprenticeship program, and Crystal just told me that it starts next week. We're really excited about this because it creates a CNA career pathway program for Forest Hills, and it's the first of its kind in the city, which to me is kind of remarkable, but we're grateful for it. And it's just the beginning. We want to get this thing rolling as soon as possible and really try and recruit and retain top-notch people to care for our seniors. Now, we recognize that this is a collective effort, and we're applying for grant funding to try and scale this and bring it to all facilities, senior care facilities in the city. And with everybody's help, we think we can get it there. But it's really a collective effort to address this crisis. And I want to acknowledge the mayor and her team, Dr. Nesbitt, the Department of Health, and everything they do to continually keep Washington's seniors safe and healthy. I also want to recognize and thank Ms. Ashley Williams, who is the Associate Director of the Office of Apprenticeship, Information, Training, and Out-of-School Youth, for working with us on the apprenticeship program and the grant funding application. So with that, I want to just express our gratitude and thanks to the mayor and welcome her for remarks.
Thank you so much. Well said. I couldn't think of a better way to say it. Well, good afternoon, everybody. I'm very happy to be with you here at Forest Hills. I'm even happier that this fine group of good-looking, hard-working people is with me because they have answered the call. They said yes when their mayor called on them for a very important job in keeping DC seniors safe and keeping our hospital system robust. Today, I am here to announce a new healthcare workforce task force. Many of you will remember back in 2019, I organized a commission of senior and very important thought leaders from across the district's healthcare systems. We called it the Mayor's Commission on Healthcare Systems Transformation. And one thing that I do when I create a task force is I make sure that it is limited in time. Enough time, but limited in time. And everyone who agrees to join the task force knows that it's not an honorific assignment, but there is one where everybody is going to work hard to develop recommendations. But then I make another promise. Those recommendations won't sit on somebody's desk, but we're actually going to transform them into actions. So the healthcare systems transformation task force that I created, that was led by key members of my team, have done a few things with their recommendations. For example, we created our Right Care Right Now initiative, where we are addressing system capacity and better triaging calls to our 911 system. To date, we have triaged more than 48,000 callers and successfully diverted 18,000 calls from our emergency response system. We are also getting ready to open the district's first sobering center this year, which will address capacity issues in our emergency rooms. And in February, I'm incredibly proud that we made good on our promise. I made my first day in office because we broke ground on a new hospital in D.C., the first new hospital in 20 years that will bring a full-service facility partnered with GW Health at St. Elizabeth's in Ward 8. But we know there's more work to do. So we launched this commission to focus on what you have heard from your leadership here, is that we need good people who are going to work across all of our facilities, especially our senior care facilities. We need to recruit them, train them, support them, pay them well, and make sure that they have a career ladder to serve some of our most special people in Washington, D.C. So I want you to know that we're focused on it. You have our commitment, and you have the very best thinking in D.C. around it. So I want to commend Dr. Nesbitt. You all know Dr. Nesbitt. You watched her, right? And the fantastic team at DC Health who helped guide us through this pandemic, and all the people that work with you every day to help keep Washingtonians safe. So thank you. And I have to commend our seniors in DC because they are 95% vaccinated. Now, some of them still need their booster shots, and you can get 2. So we want to make sure that you're up to date on all of your vaccinations. So with that, I'm going to ask Dr. Nesbitt to talk in some detail about everything that this task force will do. And I want to acknowledge members of my cabinet and members of the community who have raised their hand to help us on this task force. So with that, our doctor in D.C., Dr. LaQuandra Nesbitt.
Thank you so much, Madam Mayor. And good afternoon to all of you, and thank you so much for joining us here today. We ordered this weather just for this occasion, and it absolutely delivered. Because this is a beautiful time to be here, and I want to take another opportunity to highlight the remarkable work that's being done here at Forest Hills of DC and their CEO, Tina. I don't know that Tina would rather be in Hawaii than here. Because Tina has really been a remarkable leader in the long-term care community here in the District of Columbia. And I really want to impress upon people how big of a deal it is for us to have the CNA, or Certified Nursing Assistant Apprenticeship Program, launching here at Forest Hills, and the additional steps that they have taken to try to secure additional funding to bring that program to scale across our community. It's going to have a tremendous impact, and we look forward to continuing to support your efforts in every way. I'm also thrilled to be joined today by Mayor Bowser, Deputy Mayor Turnage, and as the mayor mentioned, some of the greatest minds in healthcare and education and thought leaders in this space that the district, and not only the district, but I would venture to say the world has, to help us think through what we need to do in the district and joining us on our healthcare workforce task force. I'd also like to especially recognize one of my key partners at DC Health, who's been working very hard to keep seniors safe, to keep our population safe, and that's Dr. Sharon Lewis, who's our Senior Deputy Director of our Health Regulation and Licensing Administration, who will continue to work very closely with me and the rest of the team at DC Health as it relates to this very specific work, the critical work that this task force will do in the coming months. You know, here in the district, we've experienced some longstanding challenges with our healthcare workforce. I have shared with folks that this has been related to both our licensed and unlicensed persons, and I won't exactly say when I graduated from med school, but it was a while ago, and we were talking about some challenges with our health professional shortages then, and those issues and challenges remain now. And, you know, Mayor Bowser has outlined for you all that in 2019, she commissioned the Mayor's Commission on Health Systems Transformation, and that commission had thought leaders in health and healthcare. And even at that time, we identified as one of the key focus areas the need to really take a close look at our allied health professionals and workforce development and what opportunities we had there for some improvement here in the district. I think it's notable that throughout the pandemic, the Bowser administration remained committed to implementing the recommendations of that commission. And to date, 20 of those 42 recommendations are in some state of making substantial progress or having been fully implemented. And I know we talk a lot about the pandemic and how remarkable of a job we did here as a community, you all doing your part as residents and us doing our part as leaders. But I think it's even more of an accomplishment that we kept our commitment to innovation. I kept our commitment to dealing with those challenges we were facing pre-pandemic and implementing 20 out of 42 of those recommendations and making those commitments in places and spaces like our behavioral health system, creating and expanding existing incentives for the recruitment and retention of healthcare providers, and making that substantial progress on implementing a integrated health system that would serve our residents of Southeast DC. So I say that and share all of that to just emphasize that while we are here today and recognizing that the pandemic has exacerbated and caused stress on our healthcare system in the district and exacerbated those challenges that were there before, I have every confidence that the work that this group will do will get that same attention no matter what befalls us in the future, and look forward to the recommendations that this group will make. You know, turnover in the public health and healthcare workforce is not unique to the district. It's happening in the National Capital Region, and it's happening across the country. And it's led to high vacancy rates in critical roles in our hospitals, our long-term care facilities, our home health agencies that are providing services to people in their home who desire to age in place. It's happening in our emergency medical services agencies, our behavioral health organizations, and even in our private physician and dental offices. And some examples, we've seen a 28% decrease in the number of home health aides we have available to provide those services to persons in their home. We have about a 20% vacancy rate across our hospitals, and these can have real meaningful implications when we think about the quality of care that people receive and the impacts on patient safety. And we always want our healthcare facilities to not only be world-class in terms of the skills that people have and the technology that we have access to, but also wanting people to know that they will have every assurance when they go into those facilities that the care that they receive will be high quality and patient safety won't be compromised. And so our ability to have a robust workforce is critical to us meeting that mission. We've outlined in our DC Health post-pandemic framework that was released in 2021 that we've already begun implementing some solutions to address these challenges, such as the temporary waiver of licensure requirements and expanding allowances for telehealth. But we know that there is still so much more that the government can do. But we also recognize that we cannot do it alone, which is why the task force will be comprised of thought leaders from the private sector across the healthcare ecosystem, as well as our education partners from the areas of vocational training all the way to our colleges and universities that offer advanced and terminal degree programs. Building off of the work of the Mayor's Commission on Healthcare System Transformation, this Healthcare Workforce Task Force has been formed to make recommendations on policies and strategic investments that will address our current state of the workforce. As the Mayor mentioned, we're going to work very quickly and in a short period of time. We'll be expedient, efficient, and very deliberate in our recommendations. And our initial work will be centered around what we can do within the first 6 months, what type of recommendations we can put in place that will have an impact in the first 6 months to 2 years. We know that many of our healthcare employers need solutions now. They need relief now. However, we don't want that urgent need to get in our way and impair our ability to think long term and to think about the initiatives that we want to have in place and be sustained over the next 5 to 10 years as well. Specifically, this group is going to look at 6 areas. We're going to be able to address barriers that contribute to the recruitment and retention of healthcare workers. We want to increase the number of district residents who are working in healthcare, especially those residents who are living in communities experiencing the highest rates of unemployment and who are currently underrepresented in higher wage healthcare occupations. We want to increase opportunities for advancement for those already employed in health careers. Some people often refer to this as upskilling our healthcare workforce. We want to improve and increase access to high-quality allied health training programs that are located in the District of Columbia and serving district residents. We want to retain more graduates of the district's world-class schools, colleges, and universities to work in healthcare in DC after graduation. And we also want to begin to have a more structured and aligned plan to increase interest in health-related fields in our students as early as middle and high school here in DC. So as you can see, we have some lofty goals, but not goals that we don't believe these brilliant minds who have joined us here today can't accomplish. And so all of this is critical to our ability to ensure that our community comes back after the pandemic as a more vibrant, a more equitable city, and the task force is going to be very intentional in our recommendations and our ability to do that. So I'm extremely excited about the work that we will do in the coming 5 months, and I'm very excited about working with all of these bright people behind me, and we're also going to be looking forward to get input from members of our community who have additional experience so we have the extended benefit of the diversity of thought. And with that, Madam Mayor, I believe we'll take some questions.
Absolutely. Thank you, Dr. Nesbitt. And I just want to let you know quickly who the members will be. And some have been able to join us, and others you will see their work as we have meetings. So Tamara Smith, who is the president and CEO of DC Primary Care, Jacqueline Bowens, the president and CEO of the DC Hospital Association, Veronica Demzian-Sharp, executive director of the DC Healthcare Association, also Robert Hay. Robert is right behind me, the Executive Vice President for the Medical Society of D.C., Ian Paragould, Executive Director of the D.C. Coalition of Disability Service Providers, and Patricia McGuire, who is the president of Trinity University of Washington, Dr. Barbara Bass, the vice president for health affairs and dean of the GW School of Health Sciences, John Garvey, the president of Catholic University. Alexis Robertson is the president and CEO of Opportunities Industrialization Center of D.C. Deputy Mayor Wayne Turnage, Dr. Barbara Bazron, who is behind me, and Melissa Bird, who is at the senior deputy at D.C. Housing Healthcare Finance, Andrew Reese, who is the director of the D.C. Department of Disabilities, Sharon Lewis, who is a senior deputy at Dr. Sharon Lewis at the D.C. Health, Deputy Mayor Paul Kine is the deputy mayor for education. Dr. Unique Morris Hughes is the director for the Department of Employment Services. Anna Smith is the executive director of the Workforce Investment Council, part of D.C. government. President Ronald Mason is the president of the university, our University of the District of Columbia. Dr. Christina Grant is the superintendent for education for the District of Columbia, also known as OSSI. Ruth Brinkley is the president and CEO of Kaiser Permanente. The panel will be co-chaired by Anita Jenkins, the CEO of Howard University, and Dr. Wayne Frederick, the president of Howard University. I also want to, did I miss anybody? Wayne? Deputy Mayor Wayne Turnage. Did I get you, ma'am? Barbara Bass, of course. Okay, so that's your task force. Give them a big round of applause. They're going to be busy. All right, so with that, I'll start with press questions and any community questions. Any press questions? Yes, sir.
Hi, Mayor. Yep. You got it? Okay. I wanted to ask a bit about the timeline here. You touched on it a bit. So when are these due to you, and then how quickly do you see some of these maybe being implemented and making a difference?
Well, I'm going to ask Dr. Nesbitt to talk a little bit about the timeline. But let me tell you what's most impactful is starting right now, which is we're getting to the end of one budget cycle, developing and delivering recommendations by fall when I'm starting in earnest another budget cycle. And then their recommendations that have a budget impact have the opportunity to have the full consideration of my executive office from November until March when I deliver it to the council. Does that work? Yeah. That's good, right?
Yeah, no, that's good. So I guess my follow-up too is we have these people, a lot of people who left during COVID or whatever the reason. Is there any talk about seeing if maybe some of those people could be brought back, or are you just moving towards finding new people to come?
Of course, we want people to come back. Now, some people have made different decisions about their work life. They've moved on to different careers. Other people haven't come back to work yet, and they may be still thinking about when they're going to come back. Others are looking for all of us to do more with support and pay. Part of my budget proposal to the council will help us use our Medicaid program so that providers can increase pay. And we know that is a big deal, especially when we're competing in this new world of work. So all of these things we're working on. We want people to know that they're safe and effective vaccines. All of our employers are doing all that they can to make sure that the environment is safe, and we want people to come back.
And my final question's off topic, if that's okay. Kenyon McDuffie, obviously you've been following that situation, I'm guessing, and just what is your thought on where things stand there? He says the fight is going to continue to keep him on the ballot. What are your thoughts on just seeing what's transpiring there?
Well, I certainly I think it's quite unfortunate because we know that Councilmember McDuffie is an attorney. He's employed by the District of Columbia. He certainly works on the laws that affect the way people live. And I think both the board and the courts have taken a very plain language reading of the law that can be clarified by the council. And it's a statute. If there's any ambiguity, it can be clarified by the council, and it should be clarified by the council. All righty. Any other questions from community members? All right. Thank you, everybody, for your attention.